Data doesn't lie, your go-to for the science behind the art of parenting.
Hi folks, welcome to this week's video. We're continuing our discussion about how we care for newborns in the immediate period, right after delivery. And last week we talked about the reasons and why and how we keep a baby warm. So today we're talking about the APGAR score. So stick with me and let's dig right in. So just some background. You guys know I like background. The APGAR score was developed by an anesthesiologist. Oh dear God, that word is hard. Anesthesiologist, there we go, in 1952 called Virginia APGAR. And the goal of this assessment is to give us an objective evaluation of a newborn at the time that they're delivered. And in the recent past, it's been there have been different papers that have tried to link it to long-term neurodevelopmental outcomes, which and that's not the purpose of the APGAR score, and trying to assign causality or a causal relationship between the two is not appropriate, and it's not strong evidence. So I would take that evidence with a pinch of salt. Anywho, so this system of evaluation is to give us an idea about how well the newborn is doing at birth. And we use 5 measures. We use the heart rate, the baby's respiratory rate, we use baby's tone, we use color, as well as reflex irritability. And I'll describe that in a little bit. We assign a score of 0 to 2 for each one. And once we assign a score at 1 minute and a score at 5 minutes, typically, and sometimes if we need to, a score at 10, 15, and 20 minutes if we're doing a lot of resuscitation for the baby. A score of 7 to 10 is considered normal or a well newborn. A score of 4 to 6 is a moderately depressed newborn, and a score of under 3, 0 to 3, is a severely depressed newborn. So that just kind of gives us an idea about the kind of what we're dealing with in that period. So if I'm seeing a score of 4 to 6 in a moderately depressed newborn, I'm doing a few different things. Okay. So if we go through the different things, the first one being the heart rate. Anything will give you a 0 if it's not present. So if there's no heart rate present, you get a 0. No respiratory effort present, a 0. No tone is poor, you get a 0. Color is, there's no pink in the lips or at the extremities, you get a 0. There's no reflex irritability, meaning how does baby respond to the things you're doing in terms of just being a sort of reflex response to what you're doing. So say I'm suctioning the nose and baby sort of like grunting away from me. I would say that that's reflex irritability. So if there's nothing present, you get a 0 for everything. Now, if there's some present, then you get a 1. And if everything is present beautifully, you get a 2, right? But let's just clarify exactly what that is. So for heart rate, if your heart rate is greater than 100, you're getting a 2, right? You get a 2. If it's less than 100, you get a 1. If your respiratory rate is weak, not intermittent, then you get a 1. If it's consistent, strong, recurrent respiratory efforts, you get a 2. Tone is good, you get a 2. If it's a little weak, you get a 1. If it's absent, you get a 0. We've talked about reflex irritability and color. If you're centrally pink, meaning the baby's lips are pink, you get a 1. If you have acrocyanosis, meaning that you're only centrally pink, you're only pink in your lips, but you're not pink at your extremities, you're getting a 1. If you're pink everywhere, your extremities and your lips, you're getting a 2. So that's just sort of what the APGAR score is. If you guys have questions, let me know. Put it in the comment section below. Share, like, and subscribe, and I'll see you guys next week.